California Democrats want to take over your healthcare, banning private health insurance and imposing a massive $500 billion tax hike across the state, including taking money out of your paycheck. This is a disaster. Coming up, we'll tell you about the government takeover of healthcare being proposed in California and what we're doing to fight to block it. I'm Carl DeMaio, chairman of Reform California and a California state representative. And ever heard the term single payer? Well, this is a euphemistic term for government-run healthcare. They want to take over our government. They want to take over our healthcare system entirely. Now, they've already monkeyed enough with our healthcare system in California. We have the most regulated, most costly healthcare provider of all states in the nation. When you take a look at, for example, an ER visit, we're talking about $3,600 for the average ER visit in California with all the mandates and regulations. Well, an ER visit in Maryland is only $680. Or how about an ambulance ride? That's $2,400 for an ambulance ride in California. But in other states like North Carolina, $650. And so the cost of healthcare is much higher than it should be. Democrats who've created the cost crisis now are saying, you know what we need to do? Healthcare is not affordable enough, not accessible enough. We need more government. That's right. That'll do the ticket. More government. So they have this bill, Assembly Bill 1900. They call it CalCare. CalCare. Like, they know that, they haven't screwed up, schools. They haven't screwed up the road maintenance. They haven't screwed up the DMV or any sort of welfare programs with all the fraud. Why don't we take over healthcare as well? Assembly Bill 1900, sponsored by Democrat Socialist Ash Kalra. Now, he promises free healthcare for all. It's not free in the least. It is going to cost nearly $500 billion. Here's a story from 2022. And this is all the way back in 2022. This is 4 years ago. The Legislative Analyst's Office 4 years ago said that implementing a government takeover of all healthcare in California, which is what AB 1900 would do, back then the idea cost between $314 and $391 billion. When you add in the cost escalator of healthcare in the state of California in the last 4 years, you're talking about $450 billion to as much as $500 billion. And remember, when government pencil pushers say something's going to cost $450 to $500 billion, understand that it's going to cost much, much more. Ever heard of the high-speed train to nowhere? So we've got a cost estimate of $500 billion. How is that going to be financed? Well, here is the original bill that Kalra proposed a few years ago. It would involve a series of massive, devastating, costly tax hikes, including a 2.3% excise tax on all businesses. Oh, they say over $2 million. Now, that's not profit. We're talking about any receipts. An excise tax is, even if you don't have a profitable business, they're going to take, in the government, a rake off the top of all transactions. Think about it as a sales tax on all business activity. Every single transaction, 2.3% on all businesses. You're not going to have a single business want to do any job creation or business activity in the state of California. Some businesses have a 5% profit margin or a 7% profit margin. Take a look at what government is going to simply just suck away. Then on top of that, they're going to increase the cost of creating jobs, a 1.25% payroll tax on the employer side for your entire salary labor expense for your business. What that means is less jobs or less compensation to go around. You have a massive jobs tax in California. The cost of employment, the cost of creating a job in California is going to be much higher. Oh, but it doesn't end there. Your employer pays 1.25%. You're going to have 1% of your salary just raked away. So 1% of your salary And let me tell you, when you add up all of that, it's still not enough money. So then they say, oh, we're going to have a progressive income tax. If you earn more as a household, more than $150,000, $149,500, you're going to have an immediate additional income tax to pay on every dollar that your household is bringing in. And of course, they have a super wealthy income tax of 2.5%. How many more of those people are going to leave the state of California and take all their tax revenues with them? This is a absolute disastrous proposal. And this is just the financial side. So you're going to see the guesstimate is about a $15,000 per household tax burden applied, as much as $18,000, depending upon some of the estimates, for government to take over healthcare. Oh, okay. So then on top of that, you're going to have government managing all the decisions, because private health insurance in California under AB 1900 would be banned. You would not be able to buy private health insurance. It would be against the law. Remember the Democrats who say, oh, hands off my body. It's my healthcare, my choice. Nope. They want to get in your wallet, and they want to make all the decisions as it relates to your health. If you like how the DMV runs its operation, then you're going to really love government-run healthcare. And if you really liked the mandates that they applied on your health decisions in 2020, oh yeah, you're going to have all sorts of new mandates applied, because they're going to make all the decisions as to who gets care, who does not get care, and what type of care you're going to get. And of course, if it's government providing the care, they can make all the decisions, including over the objection of parents when it comes to kids. Oh yeah, no control over your health care, and a sky-high tax burden that is uniquely going to impact the concept of any sort of job creation in our state. It would be a sucker punch to working families, a sucker punch to our job market, and of course, your health care will be the most expensive and low-quality health care you're possibly going to imagine. Look, this is not the solution for healthcare access, affordability, or quality. The solution is to take a look at those numbers I gave you at the very outset of this podcast. Why does it cost $3,600 for the average ER visit in California? Why can Maryland provide it for $680? I mean, it's not like people are getting substandard care in Maryland. So if they can do it exponentially less expensive, then why can't we also provide a similar cost-efficient model here in California? Take a look at all the government regulations, whether it's the staffing ratios, the frivolous lawsuits, all the other regulations that are applied to every doctor's office, every hospital, every healthcare provider. We literally are imposing massive regulatory costs on providing healthcare to you, and that's not going to give you a better healthcare outcome. There's no better quality of care, because again, I'm benchmarking against other states. People aren't dying in the streets in North Carolina or Maryland, but they're sure as hell saving a whole lot of money on their ER and their ambulance rides. We need to bend the cost curve, and that's why we need to take a cost containment approach to California healthcare, not Assembly Bill 1900, which is absolutely insane. At Reform California, we are fighting these insane ideas. Go check out our website, reformcalifornia.org. If you're not already signed up, please sign up at the bottom of the website, first name, last name, email, phone, and zip code, and you'll be tethered into the growing movement statewide to flip enough seats to stop this proposal from happening. In order for us to stop AB 1900, we have to flip 7 seats and break the Democrat supermajority in the 2026 midterm election. And we've got 26 seats that we actually feel that we can flip. If you take a look at our campaign, 26 in 2026, it's about the 26 target seats. There's a whole list of target seats on that campaign page. You probably live in one or more of these target seats. But if we get 7 of these seats flipped in the midterm election, then we can block not only the government takeover of healthcare, but a whole bunch of other costly and unnecessary and unfair tax hikes that will devastate our job market and devastate your cost of living. We can do this, but it's going to take you getting off the couch and into the fight. So Like this video, share it with your friends so they know about the government takeover of healthcare that's pending and how they can fight by joining our efforts at Reform California to flip at least 7 seats in the midterm election. Until next time, I'm Carl DeMaio, Chairman of Reform California and a California State Representative. Thanks for watching, and I hope you enjoyed this episode. But before you click away, please subscribe to this channel and click that notification button so you get updated when we post new episodes. Plus, like this video and share it with your friends so that we can help spread our message across the state.